In this section, we're going to be talking about treatment. Now, when it comes to treatment, there's a whole bunch of treatment options that you can get. I'm going to be tailoring this video more to the medication management. This is something to talk to your psychiatrist or advanced psychiatric family nurse practitioner about, only because this is for informational purposes. This is not for you to try to take my advice for what works for me and all that good stuff. You do want to look out or do your own research for the medication management therapies. I say this because when I told my PCP that I wanted the same medication dosage but in an extended release form, she instead wanted to give me 600 milligrams of Seroquel, which is a second generation antipsychotic, but in the sense that I just wanted a 50 milligram Seroquel or quetiapine. Instead of it being an immediate release, which gives me a very groggy feeling, I wanted it in an extended release. She was under the assumption that I was actively psychotic, which is not the case. I am not actively psychotic. I'm actually very normal right now. That's another video for another story, but I want you to question your doctor. I want you to get educated. I want you to be cognizant and aware and mindful of what is working for you and what isn't. We're going to be talking about medications. So what kind of medications do you use for bipolar disorder? In a general sense, and again, this is for informational and educational purposes only, you're going to be around 3 types of genres of medication. The first one, which is its own category, is lithium. Lithium is a salt. Lithium is the most effective, but it has a very narrow window of effectiveness. Lithium is one of the go-tos for bipolar disorder, especially for managing the mixed mania, acute mania, depression, that kind of stuff. I'm also going to be posting a link to a particular article that explains very thoroughly about the clinical trials, and it's very dense, so if you don't understand medical terminology, you may not understand it, but the charts and graphs will allow you to get a glimpse of what to expect. The second that is used are anticonvulsants. Now, anticonvulsants are primarily used for seizures, but there's about 3 that are commonly used for bipolar disorder when it comes to acute mania. The first one is Lamictal or lamotrigine. The other one's going to be valproic acid, which is Depakote-Depakine. The third one is going to be Tegretol, I believe, or Tegretol, something like that. It's also called carbamazepine. Regardless of whatever medication you have, there are side effects, and then there are serious side effects. And the question that you have to ask yourself, do the pros outweigh the cons? And the pro is to not become manic. The con is you may get some nausea, you may get some vomiting, you may get diarrhea, you may get lightheaded, you may get dizzy. Do the pros outweigh the cons? Again, this is for informational purposes only. And, in some cases you may get a rash, which is common for lamotrigine. In some cases you may have problems with your liver, which is common for Depakote, but it also goes to your lifestyle choices. So if you're also drinking and are doing cocaine with all this stuff, of course the medication is not going to help, and those serious side effects are most likely to occur. I do want to make it very clear that antidepressants, in theory, should not be used if you have bipolar 1 disorder. With bipolar 2 disorder, you can use antidepressants, but again, it's something that you should talk very well in depth with your psychiatrist, depending on what you're diagnosed with. But I know for sure the 3 antidepressants you should never take are MAOIs, tricyclics, and SNRIs. The particular antidepressant that I use is trazodone. Trazodone is an SARI. It is not exclusively an SSRI. It ignites different receptors in the brains as opposed to traditional SSRIs like Lexapro. It's something that I use primarily for a sedation technique to go to sleep. The big thing with bipolar disorder is sleep. You need a very good sleeping pattern. You need to try to get your 6 to 8 hours of sleep. For me, I was getting anywhere from 3 to about 5, which is not good. And my mania episodes tend to be more mixed, meaning I get very depressed and anxious at the same time, which is the equivalent to snorting cocaine and snorting Xanax, which is a very uncomfortable feeling. And then lastly, we're going to be talking about second generation antipsychotics. I particularly use Seroquel, a very low dose, which is known as quetiapine, because I do suffer from that mixed mania specifier. It is also one that I use along with trazodone to get to sleep. So again, I am not on 600 milligrams for those who are actively psychotic. I am on 50. It's also something that's used off-label for those who are suffering from insomnia. Other second generation are, I'm just going to give you the brand names. Zyprexa, Abilify, you can use Risperidol or Risperidone. I do want to give you a little bit of weariness that when it comes to benzodiazepines, those are very addictive. So your Klonopin, your Xanax, your Ativan, your Valium, your benzos are going to be very addictive. So if you're using those for sleep, I would recommend to try to shift that into something like trazodone or Seroquel, something that's going to give you a sedation feeling, because that's going to be much more helpful for you, because again, you're going to build a tolerance to that, and it's going to be counterproductive in the long run. When it comes to anxiety, I particularly take Boost Bar instead of Xanax because I don't want to be a crackhead souped up on Xanax. I hope you liked this video. If I was a little off, just please note that I was trying to name things as generic and as also as brand name, but again, I'll just post the names down in the link in the description or somewhere in the video. That is it for this video. Let's go ahead and get into the next one. Until next time, guys, stay tuned. Take care.